Welcome to In Your Neighborhood. I'm your host, Chris O'Rourke, as we continue our special series, Conversations on COVID-19. And as has happened in the past, we had a segment go a little longer than we thought it would. We had initially planned to put it as part of a 2-segment episode, but it went very long, and we decided to make it 1 episode. So as we have focused in the past on institutions helping out healthcare providers, we have a volunteer group helping out healthcare providers as well. So we spoke with them. They're generally from the Danville area, although kind of spread out. And here is that segment. And I am joined today by Jamie and Sandy Green. Welcome. Also, Emily Stoddard.
Thank you.
And Hi. Maria Qureshi. Hopefully I got that right. And then Ayusha Sinha.
Hi.
So real quick, if you could, we'll start with Jamie and Sandy and work our way around. What's your background?
So I'm an interventional cardiologist at Geisinger.
And I'm a nephrologist at Geisinger.
Okay, go to Emily.
Hi, I live in Middleburg. I'm a stay-at-home mom / graphic designer.
No kidding. Interesting twist there. And Maria Qureshi.
I'm an internal medicine resident at Geisinger.
And Ayusha Sinha.
I'm also an internal medicine resident at Geisinger with Maria.
Okay. So we'll go back down to Sandy and Jamie. I'm always curious to hear how people have reacted to what happened, what started to happen back in March. Also curious, since some of you are healthcare providers, if you had an inkling that this was going to happen. Jamie and Sandy, we'll start with you first.
We had an inkling that things weren't necessarily going to go well in the US. We saw what was going on in Italy and the kind of healthcare disaster that was going on in some regions there, and how unequipped or under-equipped most of the healthcare systems were. And we were concerned that something very similar may happen in the US. So there was it wasn't just concern by us, but it was a concern of a lot of members in the healthcare community that we may be underprepared for something at the level of what went on in Italy and elsewhere. Jamie can tell you a little bit about how this all got started.
Well, I think, this all started, I think, as we were realizing that the virus was going to really hit the United States. And this was all before universal masking came into effect. And I think we just started to be worried that initially we weren't going to have enough masks, not just in the hospital, but elsewhere. And so I spent probably an entire day worrying about maybe we should be making masks for ourselves, looking at patterns, looking at ideas. And then there was, Karen Korzik. I found out that there was a post from her on Facebook that she had designed an actual HEPA mask, which was equivalent to an N95 mask. And so I told my husband I really wasn't crazy. Maybe this is something we really should be doing. Maybe we should be making our own masks. And that just kind of, I think, expanded from there. And he took it to the next level, because if we were going to be making those masks, who was going to make them? How are we going to get supplies to make those masks? And that led to the GoFundMe effort. And then that led to a whole group of volunteers who are willing to make those masks. And it's just grown. We now have over 300 sewing volunteers. The GoFundMe has, I think, over $20,000, which we've used to purchase a variety of supplies, not just for the sewing volunteers, but it's a much larger effort. And so just trying to meet the needs of the community and prepare for the crisis.
So when exactly, dovetailing off what you just talked about there, when exactly did this whole process start for this GoFundMe group? And does it have a name, or is it just kind of a GoFundMe loosely run effort?
So, as Jamie explained, Karen sort of recruited us into this. And so within a day or two, about 4 weeks ago, I started to try to set up an organization that would be capable of dealing with this. And so the group has had various sort of names, and they're still sort of morphing. it's interesting because yesterday on the audio call, there was a long discussion with Bucknell and with Geisinger about how to rename the group into something that was more catchy than what I had originally came up with, which is not particularly catchy. So it was Central Healthcare Workers in PA against coronavirus, and then it was something like COVID PPE was the original name, which isn't particularly creative, but it is definitely descriptive. So the name has changed sort of multiple times. I think when Emily built the website, I don't remember exactly what name, but she put like PPE for Central PA or something along those lines. So it's had a bunch of different names, all which have sort of fallen under the same umbrella. But just to touch on something that Jamie has said and to give you an idea, so we've raised about $23,000 and we've spent about $20,000 of it doing stuff. We've pushed out now over 1,500 masks with at least 500 more that are about to be distributed. We've purchased 4,000 level 1 masks for immunocompromised patients, including cancer patients. We started that initiative before Geisinger started generally masking people that were coming in, and we were concerned that cancer patients wouldn't have protection and be immunocompromised. We pushed out hundreds of real N95s to workers, including the other day, we pushed out about 100 of them to home health nurses that were taking care of COVID patients. We've made Karen's design these HEPA N95s that we're having the community sew, which we aren't pushing out, but we have them in reserve in case we run out of normal PPE. We've delivered over 200 face shields to EVAN. We've sent face shields to Brooklyn. We've sent face shields to the Bronx, which are all 3D printed in conjunction with Bucknell. And we're pushing out more in the near future. We've made thousands of ear savers, which are the things that people wear behind their head to keep their masks from hurting their ears. We've worked with a bunch of places in the community to try to help them retool up and produce protective equipment. So the group as a whole has done a lot. And, internally, both Ayush and Maria can talk to you a little bit about the things that they are doing for care packages for healthcare workers in the hospital, including feeding them, which they just recently did. So the group has evolved beyond just masks in the community. Not to minimize that, because we have over 300 people in the community sewing, and they've done an amazing job to give masks to people that normally wouldn't have had masks.
Well, you've just gone beyond my whole concept of this group. So let's move on to Emily real quick, if she's still there. Emily, how did you find out about this group, number one? Well, let's start off with first your reaction when things started to go south about a month ago. And how did you find out about this group, and what is your role in it?
My reaction, I think, as a fairly new mom, I have a 3.5-year-old and a 1.5-year-old, was just a little bit of panic and concern. My husband is not much of a worrier, but he was starting to get a little worried. So that was signaling like red flags to me. And then, so my initial instinct was just to sort of jump into action, just like Jamie. I have an apparel design degree from the University of Delaware. So yeah, I have an interesting background. So that morphed eventually into graphic design, but I still have my sewing machine. I don't use it very often, but my initial sort of knee-jerk reaction was to just start making masks because the news was telling me that there weren't going to be enough. So I put out a call on Facebook just on my own for fabric and elastic, and then started to get a ton of responses, actually a lot of people immediately asking me for masks. And I was like, okay, I don't know how to handle all of this. So I was starting to gather fabric, and then my husband actually saw Sandy's GoFundMe campaign floating around on Facebook and brought it to me and said, hey, like, this looks like a group of volunteers that are already organized, starting to form. Maybe you could reach out to them. So I think I contacted Jamie. I think I talked to Sandy at first for a little bit, but I joined the group of sewers. There were like 50 of us, I think, that the slots filled up pretty fast on a different platform. And then I also messaged Jamie then and said, hey, like, I used to work full-time. I'm a full-time mom right now, but I said, if you need any help organizing the group, I'm happy to help with that too. And she immediately said yes. So we switched over, and I figured with them having kids and being doctors, I was just like, they've got to be like swamped. So yeah, thought about the best way to organize the volunteers rather than this other platform she started out using. And we just switched to a Facebook group, and I set that up. And then there was also a need to filter incoming requests for PPE. So I just threw together a really fast, really quick, basic website. But it's been serving its purpose, I think, for medical professionals and other essential workers in the community to request PPE that they need. So I think that that's seen about 85 or so requests come in, but many of them are for just a few items. Many are for, I think I saw one for like 500 masks the other day. So that's been my role. I'm trying to answer as many questions as sort of an administrator in the group as I can while getting my kids lunch and dinner and putting them down for naps. So doing my best.
We're all doing that, Emily. Real quick, go back on a couple things you talked about. First off, when did you start sewing? I mean, not for the mask, but as a person, when did you start sewing?
Yeah. If I remember correctly, my grandmother taught me how to sew when I was really little. We would always visit their house on Sundays. And I remember her sitting down and showing me how to make like a really basic, like little bag or a little pillow or something. So I think it started there. And then for some reason, I became obsessed with apparel design in like middle school, and it kind of stuck. And then I got a degree in that. And then I worked in the industry for a little bit. I worked at Macy's as an assistant designer in New York City for a year, and then realized I am still a country girl at heart. And I ended up back in central Pennsylvania where I grew up. And I haven't been sewing as much. I've done some Halloween costumes and stuff, but I was excited to be able to use this skill that I hardly use anymore. Sorry. Just, bring it out of the closet again, so to speak.
I'm really curious about the Macy's connection, but we'll move on from there. When you did your first mask, how did it go?
Very, very slowly. I think the first one took a couple hours for me to make. It was just a fabric mask. But then once I got the hang of it and got the feel of the pattern, I actually had my husband helping me one night. I would sew and he would trim, and then I started pumping out some more. But I certainly am not making the number of masks that many of our volunteers are. I switched over to making the N95 replacement ones, the HEPA vacuum bag mask. Those take a lot more time than a simple fabric mask. But I'm finishing up a batch of like 12 of them right now. So how much more time as the simple mask that you were making do the N95 like ones take? I would say they take twice as long, probably, to make. Yeah. And had you ever designed or built a website before? Oh yeah. Part of my graphic design business, I'm often building websites for local businesses. So I've done some podiatrists, some chiropractors, just a lot of different local businesses. I do fairly simple websites for them, but I build my own as well. What's the address for this website? It is, oh gosh, you're putting me on the spot. Sorry. That's okay. If you need to look it up, go ahead. Can you help me? I think it's PPE for centralpa.weebly.com. Is that right?
You got it exactly right. You got it.
Yeah, so it's a free, we didn't even purchase a domain name. It's just a free site hosted on Weebly, but it's working. Yeah. As long as it's working. Real quickly, I have to once again point out to our viewers, we're doing this over Zoom. A lot of these people are at home, and sometimes the bandwidth connections aren't exactly ideal, and so there tend to be some kind of herky-jerky video connections. They're usually the main problem. Audio usually goes straight through. Sometimes some glitches there as well. But we'll move on from here. Maria, let's go to you now. Your reaction when this all started. How did you find out about your group, the group, and your role in it?
So I think the reactions, there's kind of a chain reaction that everybody goes through. The first being, is this really happening to us and to our community? And the next one would be some level of fear that I think we all have on a personal level as healthcare workers, and then for our communities and our families. I got involved in the group because of the Doctors Green. They work with us in our residency program, so we found out about it pretty quickly through them and kind of got involved through their help and involvement in the organization. And right now, we kind of wear different hats depending on what we're doing clinically. So Aisha is on service right now, so we're kind of balancing out the work. Right now, I've been processing the requests that come in through the website that Emily has set up and organizing the packages and we have a community of volunteers, a lot of residents and a lot of people in the community who are volunteering to deliver the masks from our sites to the various organizations who are in need. So coordinating the deliveries is also something that I've been doing for the past few weeks.
And this is something that probably 2-3 weeks ago, you probably never saw yourself ever do.
No.
Okay, Ayesha Sinha, your reaction to when this all started about a month ago, how'd you find out about the group and your role in it?
Sure. Yeah, so I also was in sheer panic. I think I was actually initially I was like, this can't be real. This isn't actually happening. This is all a hoax. And then it started to hit with everything happening all around the world, Italy, and I was like, oh my God, this is real. I was very anxious. So I wanted to help, but I didn't even know what we could do at that point. And like Maria mentioned, Dr. Green reached out to our residency and said, if anyone's interested, we are starting something. So that's how I initially got involved. And then Dr. Green called me one day and said, hey, I need more help. I need someone to step up. And I was like, absolutely. I was more than willing to help out in that regard. So I started out with just trying to logistically coordinate out the volunteers, trying to figure out how we could get people to get together at Dr. Korzik's to start making these masks, making kits. And the other effort we were trying to do was care packages for healthcare workers in quarantine. A lot of times healthcare workers that have to be in quarantine, they can't go back to their family because they don't want to expose them. So they're staying somewhere else and, they don't have basic toiletries or, they can't, if they're staying at home, they're not able to get out to get food and get groceries. So we actually had a bunch of people donate lots of toiletries, and we as a group made care packages consisting of these toiletries, and in each of the care packages there's also a contact information with my information, so if they want someone to help get their groceries for them, or if they need help with food, I have a group of volunteers that are willing to do the drive and pick those things up to help them with that as well. Eventually with the rest of the group and getting all the logistics involved, I realized it was getting out of hand for me alone, especially being on service. So I was able to have Maria and as well as a few other people kind of recruit them in and tell them exactly what we were doing. And we've been able to get people to help along with that as well.
So how long after the effort began, and I don't know if you can answer this question, Ayesha, did the care packages start? When did you realize that this was an issue?
Sure. So I have to give credit where credit is due. Kenny Snell, he's one of our ICU fellows. He's the one that actually started the effort with the care packages initially, and that was even before I signed on. Dr. Green actually called me and said, listen, Kenny's going on service. He needs someone to take over. So it was probably happening around the same time that the mask started. And I think Dr. Green and Kenny got together, and then when Kenny went on service, Dr. Green reached out to me.
And it's something that you wouldn't, if you're not a healthcare provider, or I've actually wondered how I would handle being in quarantine away from my family, that you probably didn't think of either.
Yeah, definitely. I mean, it is scary. I don't know how people are able to do it, but I will say there's a lot of, I have friends who recently had babies, and so they actually have been quarantining themselves away from the mother and the child just to keep them safe. And so I think it's admirable that they're doing that, but it's definitely hard.
So let's go back real quick. The group got its start. We already heard how that got its start. And how many members initially, and we're going to go to the doctor's green because I love that reference to this one. How many members initially got started with it, and go over again the numbers of people you have working for you now?
You want me to speak to that?
Yeah, go.
So essentially when it initially started, it was just Karen Korzik. She was the nucleus of all of this. And, like Jamie sort of said, we got involved pretty early. And when I got involved, when I contacted Karen to get involved, she's like, well, you're now my chief operating officer and my chief financial officer, so go out and make it happen.
Yeah.
And so unfortunately, up front, it started with just a few people. And the Biters, which are a local company in town, helped out a lot with that. So they were the ones up front who initially sourced a lot of material and a lot of people, and acted up until the point where they closed as a drop-off and pickup point, all out of the generosity and at some degree of risk to themselves, which was pretty amazing. So, for the first couple of weeks, there was probably about 50 total people involved, with about 4 different people sort of organizing everything. So Karen, Kenny, myself, and Jamie.
Emily. Early.
Well, the first week, and then it sort of rapidly expanded with people like Emily or Ayusha or Maria sort of picking up within a week or two after everything started getting going. And there's a bunch of other people that we're not naming, for better or for worse, who have done amazing things to make this move forward. Without them, we wouldn't have been able to do any of this. I mean, I rapidly reached the limit of what I was capable of doing within probably 24 hours, which is why I had to sort of immediately start tapping other people, because there were just too many things going on. And when we sat down and thought about the number of things that needed to be done, even before the group had grown to the size that it grew, it was unmanageable for 1 or 2 people, especially with most of the people who started out being doctors as well and having to do that. Jamie and I were sort of fortunate because for the first week of this, we had a lot of free time just because coincidentally there was vacation or study time that was scheduled, which allowed us to get it off the ground. But if you think about it, initially a lot of the core leadership was all docs. And Maria and Ayusha are residents right now. So they're doctors who are actively in the midst of training and who are in some senses much more busy than Jamie and I are, because they have to learn and be physicians at the same time. So without, a tremendous amount of people in the community like Emily stepping up, this would have never become what it became. So right now, I mean, we have I believe over 300 people who are sewing in the community group, and probably many more that aren't accounted for in the actual Facebook group itself. We have a whole crew of professors from Bucknell who are working on the reusable N95 project. We have groups of residents. There's probably about 10 residents, core residents, or 15 core residents who, for the first couple of weeks every day, would go over to Karen Korzik's in their free time and cut material to be distributed as mass packs, and cut elastic, and to cut, whatever needed to be done, and then bag it up so it was easy to distribute from Biters or other locations. So the effort has gotten quite big. And, not only the core group of people who are making it actually run, but the number of volunteers actually doing something has grown exponentially. And we continue to get requests for people who want to sew, and not just locally. And that actually has been one of the difficulties for us, is figuring out, do we want to try to manage people outside of the PA area doing things like this? Because, people out there want to help. And, you're being told to stay in your home. You're being told that this is dangerous, and you feel powerless. So efforts like this, what it allows people to do is it feels like, one, to feel like they're making a difference and to feel like they're not trapped. And so it's really resonated with a lot of people in the community. I hope that answers your question.
Yeah, it did. But I also imagine you have a newfound respect for people who begin grassroots efforts like this.
I think so, but it has to, it's not just any effort, it has to speak to the ethos of the time and the place. I mean, this has worked, I think, particularly well because everyone's in this together. And so, and everyone wants to feel like they're helping. I think the most surprising thing, and I guess maybe I'm a little bit of a pessimist, is how amazing and how generous the community as a whole is. They've really stepped up, and it's been extraordinary. And sorry, those are my kids in the background. I mean, not just individuals, but I mean, businesses as well. I mean, businesses have been incredibly generous. You know, and I want
the local Walmarts donated a lot of fabric too. I forgot about that. So that was good.
Yeah.
And the volunteers themselves. I mean,
Yeah.
all that, not just the time, but I mean, a lot of sewers have saved up fabric over the years. And just, I mean, the donations from the volunteers has been incredible. Not just their time, but their materials. And just, you know, offering to help in any way they could. I think that we really do live in an amazing community of people who care for each other and you know, the health system, and so, and all the health systems and organizations around. So it's just been very inspiring.
I'm surprised to hear that there are 300 sewers out there. I always thought sewing is a bit of a lost art. Emily, maybe you could speak about that. Are you surprised to hear that there are that many people sewing?
I am. Yeah, I mean, it's been interesting because I will say it's an older hobby, I guess. I don't know many people my age who still have a sewing machine. But so the mix of that with the technology of Facebook has been a little bit of a challenge, but Ayusa has kind of put herself out there to be a contact too for anybody who doesn't have Facebook and isn't even in our group. So I think she's managing some volunteers who are sewing that don't even have communication with us online. But yeah, it's surprising how many people are able to sew around our area. It's pretty cool.
So the interesting thing I'm also learning about this group is the network of partnerships you've established since you got underway. If someone could talk about that. Maybe the Doctor's Green again.
Sandy, I think that's you.
I think that would probably be me. So one of the things that we've noticed, that I've noticed, is that small groups of determined people can move much faster than large organizations can. And so because everyone wanted to help, I was incredibly surprised by the number of businesses and the number of individuals and the number of people within individual organizations who wanted to actively be working on things that may or may not have been officially sanctioned. So this is times like this allows collaboration which may not have otherwise have been possible. So we have representatives from the community who either are donating stuff or trying to tool up to make things that are helpful to us. We have professors from Bucknell working on all sorts of inventive solutions to problems that haven't even occurred yet. We have individuals from Geisinger who, even in their official roles at Geisinger, have been working with 3D printing and thinking sort of constructively about how to fix problems with the supply chain or how to build and make things that we might run out of. A lot of it was through word of mouth. So one person would know someone else who's interested in helping, and that's how the network would get built. Or, a lot of it are connections that we already had in the community. One of the really interesting things about this area is that it has one of the highest per capita healthcare workers in comparison to the total population. So everyone is hooked in with someone who works at one of the healthcare systems. And so that makes a very tight community. I mean, this is even evidenced by, when things aren't in crisis, when you go out into public. I mean, I see patients of mine and friends and family of patients of mine and, relatives of patients of mine, all who recognize, myself or, other caregivers that have taken care of their families. So when it became a crisis, everyone is telling you who they know who might be able to help in this context. And every business is much more generous than they may be in other places in the world. And so it allowed us to sort of rapidly make connections and build alliances with people who may not have, under normal circumstances, been willing to break down those silos, if that makes sense.
So Did those connections then move you quickly from your initial goal, which may have been to just sew masks, to move to other types of PPE?
I don't think Karen ever intended on just sewing masks. Karen had a much bigger vision from the beginning. I think she wanted us to all think about very aggressively about all the different things that might run out, not just masks. I mean, she very, very early on had us thinking about how we were going to replace the wipes called cavi wipes, which are the wipes they use to wipe down themselves after they come out of COVID rooms to keep the equipment sterile. And so, I at one point found myself running over to Home Depot and Lowe's and buying out their entire stock of bleach and heavy duty towels so we could make wipes if we had to, in that sense. So I think Karen had a much broader vision. So from the beginning, I don't think we were just focused on making masks. I think that the reason the mask part blew up so quickly was because it gave the community an opportunity to do something. And so, once the community saw that there was an opportunity to do something, they filled that gap as quickly as they could. And, to be honest, we're not the only group in this community making masks. There are other groups in this community that are making masks and doing wonderful things. And they probably have as many sewers as we do. Seamstresses and tailors, I've learned is the appropriate term. So I don't want to get myself in trouble with that community, which I've done before. So, there are seamstresses and tailors, there are a lot more than the 300 that are just working in our group. I know at least some of the other group have hundreds. There's a group in Lewisburg, there's a group in Bloomsburg, there's a group in Berwick, some of which are working with us and some of which aren't, who are not, but all of them are doing good things. So that's the public face.
But I also think the importance of masking has evolved. And when this first started, it wasn't entirely clear that wearing a mask at all times was useful. And so initially it was just for healthcare providers in high-risk situations. And then we've learned that, I'm sure you've heard that my mask protects you, your mask protects me. So just wearing a mask in public, and really anyone wearing a mask in general, helps prevent the spread of germs. And so that has, I think, made the requests for masks and the need for masks even more important. Initially it was, I don't think we had any idea how many masks were going to be needed in the community when we started this. And now it's all the volunteers are really needed.
I'm also curious, and Maria and Ayush, if I could ask you these questions before. You guys are residents, so not too far out of medical school or along the process of becoming doctors. Had you dealt at all with PPE in the past before this point? Maria, we'll start with you.
So as a medical student, where I went to medical school, we did have PPE like N95s that we used in my training to deal with patients with tuberculosis. But we never dealt with it on this scale and never had a shortage at that time because the need was not as great. Didn't affect as vast of a population as this disease does and will.
Have you, I know I can't, there's a certain boundary I'm playing on here. Have you been able to consult at all on some of the stuff that's being made?
I personally have not. I don't know if Dr. Green wants to speak to that, but I personally have not.
Okay, we'll get back to the Dr. Green in a second. Ayusha, how about you? Did you deal a lot with PPE in your training?
So similar to Maria, I mean, N95s for TB patients, and I can't say that we saw a whole lot of them, maybe a handful, but nothing in the concept that we're dealing with now. And we never dealt with any shortages of any protective gear ever.
Okay, Doctors Green? Yeah, you guys, it hasn't been that long, has it, since you were in training that you dealt with PPE?
In all honesty, I had to go to a training course when this all started to relearn how to don and doff and how to teach other people how to don and doff a lot of this protective equipment. Because the level of protection that's required for this is far above anything that at least I experienced during my normal care of patients. It's much more effective than most of what we deal with, in all honesty.
I mean, we did our training together. And we had, where we trained, there was quite a large population of tuberculosis patients. And so we did wear N95s quite a bit, but the transmission is not as high. And so it really kind of, I mean, you gowned up, you put your mask on, you did it, you know, it was uncomfortable for the short time that you needed to wear your N95, and that was the end of it. But we at least had a little bit of a background, I guess, in using that. It's very interesting because I think this community has a very low percentage or rate of tuberculosis. And so I think that makes it feel even more overwhelming because it's not something that we're typically wearing at the hospital. It's very rare to have someone on precautions like that.
So with the efforts from Bucknell, and I think Bloomsburg to a certain extent as well has been working on this. Have you guys had to consult on, have they brought you N95 respirators and had you try them on, and are they comfortable? I know they were working with gaskets and stuff like that. And the intubation tents, and the face shields, did you consult on all that stuff?
Yeah, so the working group that's working on this consists of 4 professors from Bucknell, the head of 3D printing for Geisinger, one of his people who runs his 3D printing lab, myself, another consultant from Bucknell, and then people from the intermediate unit. So we have every other day calls right now to talk about this. And then, so my main job in those calls is, one, to keep the engineers moving in the direction of what we need, to update them about what I think the current needs are and where we should be concentrating our efforts. And then I'm also the connection between them and the docs. So when they manufacture something, so when we produce prototypes of the N95s, what I do is I get those N95s and I give them to docs to wear them, to see how long they can wear them, whether they're comfortable, whether they work. And we end up fit testing them to see if they actually serve the function. And then I bring that feedback back to the engineering team. I have to mention the IU in particular, which is an entity I didn't know existed before a month ago, the intermediate unit. They are the ones who are right now bearing the brunt of manufacturing for us. They've been amazing. So they have essentially corralled all the printers, the 3D printers in PA to help us make protective equipment. And so I put in a request to them, and next thing I know, a day later, I have 3,000 ear savers, which they managed to produce from various printers around PA. And when we started producing the face protection, the face shields, I would tell them how many I needed and when I needed them by, and they would just produce them. And so, you know, Bucknell and Geisinger has been sort of working collaboratively to design things, but it's been the intermediate unit that is the workhorse of producing stuff. And that they have been incredibly generous in this effort and in trying to make protective equipment for healthcare workers.
And you said that the masks you're sending out to Evan, Geisinger, other hospitals across Pennsylvania, but also outside of state as well. And how did that come about? How did you find out about that? So
there are large networks of doctors which are interconnected on Facebook and elsewhere. And so we're always talking about, you know, who needs things, what's going wrong, what is the experience of those physicians in the hot zones. And so, you know, in the United States right now, the areas that are the worst off are New York City itself and New Orleans. And so there are a lot of emergency room critical care physicians who we're connected to through a bunch of different channels. And so oftentimes they'll come to those channels and say, hey, you know what, we're currently seeing COVID patients without face shields. Does anyone have access to face shields through various channels? And so, you know, as part of a larger physician and healthcare community, we try to supply that if we can. We try to find ways to help people. And I've had people just, you know, heard about the effort and have contacted me outside of the immediate PA area. We had Evan Supply Chain ask us for things that would be helpful for them. So, I mean, it's a very all-around collaborative effort. And so, you know, if someone asks us for something, this is all free. I mean, this is all volunteer. This is all donated. And we ship stuff to them.
Well, I think it's interesting too how quickly the website and link spread for PPE requests, as well as our volunteer Facebook group. So we had numerous requests from people across the not just country, but even internationally, requests to join the volunteer Facebook group to sew, as well as requests through our website for PPE requests from out of state, because I think that in states or institutions where they're really struggling for PPE, they're just looking for any resource they can find.
So is there a way that you can direct out-of-state sewers to facilities closer to them to provide supplies for those facilities?
That in some sense is a little difficult. It's hard enough to coordinate everything that's going on in state. We've thus far elected to send things out of state when our local hospitals and local healthcare workers have enough of them. But I'm not sure, as big as this organization has gotten so far, I'm not sure we're up to coordinating, multiple states sewing efforts at this point. I think we've tapped out a lot of our volunteers.
There are some national groups that are attempting to do that, where they're trying to match up sewers with hospitals in their state or other places. I think I've watched that evolve, and it seems like what has ended up happening is just locally people are trying to meet the need where they're at.
Amazing stuff. Just amazing what you've been able to accomplish in just a couple of weeks. So we usually wrap up our program by getting all up in our feels, so to speak. And we're going to start with Ayesha first. Ayesha, how are you dealing with this situation personally?
So personally, I think just being involved in this group has given me a lot of opportunity to just channel my anxiety and concerns about everything going on in a positive way. Knowing that I'm helping kind of helps me feel better about how everything's working. I found that I'm exercising a lot more to get rid of that energy, and definitely taking long hikes with the weather getting better. And I'm definitely more conscious of not being able to see family and how people aren't able to spend that time with family. And, right now I'm on service, and one of the things that is the hardest for me is patients and how they can't be with their family while they're in the hospital. So just spending a little extra time with them to know that there's someone there to take care of them, and making that conscious effort makes me feel like I'm doing something to make people feel better and make myself feel better.
So Maria, how about you?
I think personally, I agree with what Ayesha said. This group has really helped redirect some of the anxiety that I've had around the situation and channel that into a way that's productive and positive. I think some other things personally that I've done now that we have this free time from being staying at home, I finally read a book that didn't have to do with medicine after maybe like 5 years. So that was nice. But I think having the group and having these people, that we work with, that we're privileged to work with, and seeing how the community is able to interface with us and have this amazing result has been really cool and helped a lot.
Emily, how about you? How are you doing?
Oh, I'm good. It's, we've also, I used to put it so perfectly. Like I've told a couple people have been like, oh, this is so awesome, you're doing this. And I'm like, to be totally honest, it was for selfish reasons, because I was so anxious at first. Like both of the girls said, it really has helped kind of calm my anxiety, just knowing that there are so many people in this community that want to help, and that none of us are alone, that we're not going to let our healthcare workers hanging. We're not going to let our grocery workers just hanging without masks if they need them. That there are so many people here that want to help. And yeah, my family's been getting outside a lot too, working in our garden and playing with our chickens and stuff. So I totally miss my family. I totally miss hanging out with other friends. But we've been doing a lot of video chats, and we're all gonna get through this.
I'm going to put you on the spot again. Is there an email address that people can use to reach out to your group? Anyone? Even if Emily doesn't know? If not, I'll get it from you later.
Here. So I think the easiest way will be to have them reach out to me. I've kind of been coordinating what areas to put everyone in touch with. So my email is Sinha, SINHA .ayusa@gmail.com. So they can just shoot me a quick email and with whatever questions or concerns they have, and I can direct them to whoever should be in charge.
Perfect. Thank you very much. Now we move on to the Doctors Green. How are you guys doing?
I think we're doing okay. I think on the clinical side, it's been very overwhelming. And when I'm dealing with clinical care and having to be super cautious about washing my hands and wearing my mask and not contaminating things and not bringing those germs home, it's overwhelming. But aside from that, I think this all has been in some ways, like many, difficult times. There's always a positive that comes out of it. And so I think that it's allowed me to have more meaningful time with my family, not running all over the place to activities, forcing us to spend time together, which is great. And just even with my colleagues, like the others have said, it's when you realize how precious face-to-face time is, you really make it meaningful. So I'm grateful for the time that I am at work to be able to at least interact with people and my friends and colleagues. And I'm grateful for the support I have with at work. I love the people I work with. I actually really do love my job. And all the volunteers, especially the people on the call, but all the people who are, not on the call. I just have been so inspired by the community that we live in. And it just makes me proud.
Sandy?
I guess a little less inspirational. I think one of the things I learned is that I'm a lot less patient person than I once thought I was. I feel an incredible gratitude towards school teachers, which I didn't feel prior to this. Having every free moment taken up by either my kids or this effort. It is incredibly tiring, but it's incredibly rewarding. And I'm sort of reminded of that each day. And, I'm going to echo something that Jamie said, the individuals that are on this call, and the individuals who, have contributed but aren't on this call, have made this effort possible. And I feel like a lot of the times that, I am just trying to keep up with all these other people who are doing amazing things. And, I've said multiple times that I'm actually the least important one in this effort. And I really do mean that, because, the amazing thing has been, I've just been pointing people in the right direction, and everyone has been doing these extraordinary stuff by in their own free time. And, I know I'm getting a little inarticulate, but it's kind of emotional because it's pretty amazing. And it's reminding me, how amazing the community is and how amazing the people around me are, and how lucky I am to be sort of privileged enough to be able to take part in these things. So, even though it's tiring and even though it's hard, and even though I'm not as patient with my children as I'd like to be right now, it's a pretty amazing experience doing amazing things for an amazing community. I think I said amazing enough times in that.
It's okay. It was amazing. Very articulate and very well said. And I'd like to thank you all for your time today. The Doctors Green, Sandy, and Jamie, thank you very much for your time.
Thank you.
Emily Stoddard, thank you very much for reaching us from Middleburg, I believe is where you said.
Yep, that's correct. Thank you very much.
And Maria Qureshi, thank you very much for your time today.
Thanks for having us.
And Ayusha Sinha, thank you very much.
Thank you.
Chris, can I give one last shout out before we go?
Absolutely, go at it.
I just want to say thanks to the actual, we're getting a lot of credit here for a lot of the things that we're doing, but I just want to give a shout out to the actual critical care and ED workers that are actually on the front line, who are dealing with this on a regular basis. And that's not just the physicians. It's the nurses who, arguably are at higher risk than any of the docs are. It's the respiratory therapists. It's the environmental service workers. It's the food service workers. It's all those other people who are making those jobs possible on a regular basis. And I just want to make sure that they're acknowledged, because, you know, this group is amazing and they're doing volunteer work, but the people who have the really difficult, hard, and dangerous work are not us. They are the people who are directly in the ICUs and directly caring for those patients and directly cleaning those rooms. And I just want to give them a shout out because, you know, I'm grateful that we're being acknowledged for the things that we're doing, but they're the ones who are the ones who are really taking the risks. And they're the ones who this whole adventure, happy adventure, is for. So I just want to make sure that they get acknowledged, and people should really think about them every day because they're the ones who are keeping us safe, including the fellow physicians who are on this call. So I just want to say thanks to them.
And we would like to thank the Greens, Jamie and Sandy Green, as well as Emily Stoddard, Maria Qureshi, and Ayusha Sinha. If you want to help the group out, check out that website, which we will post on our Facebook page, and also send an email to Ayusha. And good luck with them on their efforts. And that's going to do it for us. Thanks for joining us. I'm your host, Chris O'Rourke, for this special series of In Your Neighborhoods called Conversations on COVID-19. Stay safe out there.